And back now, Sunday Housecall, our segment, Should I Worry?, where we talk about everything that worries us. One viewer writes, my white blood count has been low the last 3 times it was taken. My primary care doctor suggested I see a hematologist. Should I be concerned? Dr. Siegel.
Maybe. I mean, maybe he should be concerned, but we don't know the underlying reasons. And Eric, you've asked about this a lot, too. The regular blood tests you get from your doctor, this is one of them. Now, what is a white blood cell? A white blood cell is a cell that looks at a foreign bacteria or virus coming in and either engulfs it and destroys it or secretes an antibody to kill it, a chemical that just goes and kills it. So we need them to function, and if they don't function, we end up with infections, and we really have a problem with that. What causes it? It can be caused by a virus, by cancer, and several other things that Dr. Samadi will get into. But basically, a lot of your drugs can have side effects that can cause this. Blood pressure medication, antidepressants.
Can lower your white blood cell?
That's right. So a good internist will look at that. It'll be a Sherlock Holmes and say, why is this happening? Is it an infection? Is it due to medication? Is it something else going on?
I mean, I think you have to look at the source of where white count is coming from. We talked about bone marrow, which is almost like a bank that has many different currencies: red blood cell, platelets, white blood cell. White blood cells are the soldiers that will protect us from any kind of virus or bacteria. If you've gone through, for example, chemotherapy, that can affect your bone marrow. If you have a cancer in the bone marrow, now you're not producing those white cells. That's when you would have a low white cell.
Is that a sign potentially of having, I'm sorry.
Certain cancers.
Okay.
Certain cancers. Certainly if you have had radiation, if you have inflammatory bowel disease, rheumatoid arthritis, those are some of the reasons why your white count should be low. We talked during the commercial that if you get a number that doesn't make sense, you're perfectly healthy, you go to the doctor, you get either a low white count or a high white count, it's always good to repeat your blood test and find out if that's accurate or not. And there are some injections that we can give you to boost your bone marrow to make more white cell if that's necessary. But one also needs to rule out diseases such as tuberculosis, which we don't have a lot, or HIV. That's another reason. Now, how low is low?
Leukemia also, and lymphoma. By the way, I want to say one more thing. If you have this, you really should stay away from people who are sick. That may seem obvious, but you're really at higher risk of getting
Siegel,
infected.
how do you know if your white blood counts?
You probably don't know it. You know, you may start having some erosions on your gums. There's your hair can fall out. There's ways you can know. You feel fatigued, or you may have no symptoms at all. We pick it up.
But you want to make sure that if you really have a low white count, to cover your mouth, not being crowded, wash your hands. Don't use razor because you can get an infection. And for women, it's probably advised not to get tampons because that increases the risk of infection. And don't get a flu shot until you talk to your doctor. Those are very important points.
Wait, quickly. How does using a tampon increase the risk of infection if you're...
Toxic shock syndrome. And we're going to post it on our Facebook.
Okay.
But flu shots, I'll still give you.
Okay.
Flu shots you can have.
We'll talk about that in the coming weeks because that season is coming.